Lindokuhle Xulu joins us now for more. So, Linda, the Gauteng Premier expressing real concern about these COVID infections in the province. We've seen them jump so high so quickly. How close does he think we are to the fourth wave in Gauteng?
Well, it's a question that is on everyone's mind, particularly residents of Gauteng, but also it's a question that we've put to the Premier to get a sense really of where the province is as far as that looming fourth wave is concerned. And let me just bring into perspective the numbers at the moment that we have in terms of the latest statistics. And it's around 4,373 cases, new cases that were reported yesterday, and over 3,100 of those cases have come from Gauteng. That's about 72% that's coming from Gauteng in terms of the COVID cases that were reported last night as the latest stats. We know that those stats come in at around 7 p.m. So we'll be looking forward to get a sense of what they mean today. But essentially we asked the Premier about this, asked him about where we are as a province. And one of the things he's told us is that we are indeed in the early stages of the fourth wave. But he says that they are concerned at the moment and they want to officially announce if we are in the third or fourth wave when officials and authorities from the health department actually give him that go-ahead. But as far as the fourth wave is concerned, he says that we are entering the early stages. Let's take a listen to the Premier just answering some of those questions around the concerns as well as how far we are in terms of the fourth wave.
Whether we are in the fourth wave or not, it's a matter that will be declared by the scientists. It's a technical issue. The reality is that the numbers in Gauteng, the cases, COVID-19 cases are rising rapidly. When we looked at what we are going through, we are extremely concerned. That's why we would like more people to vaccinate, because it is the people who are not vaccinated that are going to overburden our health services.
I mean, the sense really is, barring a miracle, we are heading for a fourth wave in Gauteng, certainly. The big question is, how well are authorities preparing for a rapid uptake of hospital beds in the province?
Well, there hasn't been a comprehensive answer really in terms of what is going on behind the scenes. But one of the things that the Premier said is that from the previous couple of waves, the latest one being the third wave, he says that the province's health department has taken lessons from those, and that they are not doing anything different really to prepare for the fourth wave. But one of the things that the Premier also said was that at this current stage, what they are in fact witnessing is a lot of people coming to get their vaccines. He says that this number has increased greatly in the last couple of days since the announcement of the Omicron variant that has been detected in the country. So he says that according to him, quite downplaying it if you ask me, but he says that according to him, he believes that the fourth wave will not be as severe, it will not be as hectic as the previous waves, because there are more people that have been vaccinated, and he says that the number is increasing daily. But there is cause for concern, Sally, as you I'm sure would be aware that there are some hospitals, there are some institutions that are already flagging that there is difficulty when it comes to hospital admissions. He also said that doctors that they've spoken to who are observing the trend are saying that young people, more and more young people, are in fact being admitted. He says that the great number of those that are being admitted with severe intensive care are those that have not been vaccinated. But he says that as far as the fourth wave is concerned, they do believe that because of people now being vaccinated, that it won't be as severe. But let's take a listen just in terms of what those preparations are and what he said around that particular question.
We now know the pandemic. We now know how to organize the health services to respond to the peak. So the assurances we have received from our teams, from all our institutions, is that they will do that which they did during the third wave, which was the worst. We were not overwhelmed during the third wave, and our health services are ready also for the fourth wave. With the vaccination increasing every day, we think we would even have a much better outcome with the management of the fourth wave.
Well, yes, we have learned a lot over time, but of course, Linda, we're also dealing with massive uncertainty around Omicron. We're still waiting to get further details on just how quickly it can spread. And speaking to the head of the ICU at Chris Hani Baragwanath last night, Ruda Matiba, she was flagging not only the younger patients that you're talking about, but also the fact that hospital staff, more people are needed, more nurses, more doctors. Did the Premier say anything about a plan to bring more personnel on board should they be required?
Nothing at all about that, Sally. In fact, more of the same is the message from the Premier to say that we know the virus. We have experience with dealing with the virus when it peaks in terms of the different waves. But he didn't speak anything. He didn't say anything when it comes to increasing capacity, increasing beds, or increasing anything. What he said was that they will do more of the same in terms of what they've done before. He says that there are those that are minding and just observing these particular institutions, those that are in charge, that are basically saying that they are ready for the fourth wave. But obviously, most of the time we did find that the scenes at hospitals is adverse to what officials would be saying. So it would be quite interesting to see really what happens when it comes to the beefing up of the health workers as well as some beds. But at the moment, the Premier of the province did not announce anything like that. What he said was that they'll be doing what they've done before when it comes to the various other waves.
All right. Well, thank you very much for that update. Lindokuhle Xulu speaking to us about what's going on in Gauteng. And we do know, of course, that later this evening we are expecting to hear from the Health Department.